Welcome back. A new report by the Socio-Economic Rights Institute shows that more than 23% of South African households face serious food shortages. So the report highlights how vulnerable groups like informal workers, recyclers and domestic workers and people living in informal settlements struggle daily to access food. Effects of the COVID-19 pandemic made the situation worse, and the interviews with the partner organizations reveal how severe food poverty is in both rural as well as urban areas. Joining us now to unpack the findings is the lead researcher, Dr. Yvonne Erasmus from the Socio-Economic Rights Institute. Dr. Erasmus, a very good morning to you. Thank you so much for making time for us this morning. What would you like South Africans to take away from this report?
I think, first of all, good morning, Aldrin, and good morning to your viewers. I think the first point really is that the situation is dire, yet we seem to have normalized that there's a crisis in our country. And perhaps that is because the crisis is within households, so we don't always see it. And there's quite a lot of shame, I think, connected to people feeling that they are not able to access the food that is available. I think the key takeaway from our report really is that we have a crisis within the context of plenty. The problem is not that there isn't enough food in South Africa. In fact, we produce more than enough food. We export quite a lot of what we produce, and we also waste a third of the food that we produce annually. So about 10 million tons a year are wasted. Yet we have this large proportion of people that you mentioned in your introduction that don't know where their next meal is coming from. And the key issue really is around what's called economic access. So people are not able to afford to buy the food to buy a nutritious basket of food. So that's really the key takeaway. It's not that there isn't enough food, it's around this mismatch between the food that is available and it reaching the people that need it.
Yeah, and that particular aspect around economic access to food speaks to one, the cost of living, the cost of food, but then on top of that we also have a situation where we have a country that is highly, highly unequal, and then of course we speak about poverty.
Mm-hmm. Exactly. And so one of the things that we've learned from our research is that it's not, so food insecurity affects all low-income earners, not just the unemployed. So it's a part of you that would think it's only the person standing on the street corner that's struggling, but it's not. Those who are low-income earners, so for example, domestic workers and farm workers who are supposed to be earning the national minimum wage, are also struggling to afford nutritious food. And yes, so we're trying to, so our advocacy in relation to that is, first of all, for the national minimum wage payment to be enforced. I think some employers think that it is an optional thing, but it is not. And it really affects people's ability to buy food. And then secondly, it is around food pricing. So we're calling for the monitoring of food pricing, but also potentially the subsidization of a nutritious basket of food. And that goes beyond VAT exemption, but also we're also calling for VAT exemption together with a discount or a cap at retail.
How would that work? Just give us an example maybe of a food item around how do you introduce a cap?
So it would really be a request for retailers to sell it at cost. So to not make a profit out of that particular item, because retailers make so much money anyway off food and of other items that they sell, that we feel that they can absorb that supposed loss on a particular food item. Say it's it's fruit, it's just an example, apples or whatever it is. If it's an item that's already VAT exempt, so for the retailer to also sell that item at cost. Because some academic research, so not our own work, but there is literature that suggests that VAT exemption is not always passed, that benefit is not always passed on to the consumer. So government exempts food from VAT, but it's not actually monitored whether the retailers implement that discount and pass it on to the consumer, or whether they, in fact, just absorb the money themselves.
Yeah, there's another interesting finding in the report. Half of all adults in South Africa are overweight or obese, while 69% of adults who are obese live in households that are food insecure and therefore have little choice about the food they eat and its nutritional value. Speak to us about why that particular element is so important in this conversation, especially around not just food, but nutritional food.
Exactly. So that statistics come from a recently published large-scale national survey commissioned by the Department of Agriculture and done by the Human Sciences Research Council. And what that really shows, so we're not talking here about rich households who are where people have access or have the choice to eat nutritious food, but people don't do so. We're really talking about poorer households and what's called the triple burden of malnutrition. So you have what's called overnutrition. In other words, you do have access to food, so you are not hungry. You feel full, but you're eating the wrong kind of food, and you're eating a lot of it because that's what you have access to, and therefore that's where the sort of overweight and obesity comes in. Then there's what's called undernutrition, where you don't have access to enough food for your energy levels. And then there's the point of micronutrient deficiencies, where again you have access to food, but the food that you are eating is not providing you with the micronutrients you need, such as vitamin A, vitamin E, vitamin C, etc. And so there's a clear link between sort of obesity, being overweight, and being food insecure, because people, for financial reasons, don't have the means to buy a nutritious basket of food. They have to make trade-offs based on other costs. So research also shows that people have to deprioritize food in order to meet transport costs, because you have to go to work to earn the money to pay for your electricity or energy, which is the second highest item that people spend money on, and then spend money on food, on whatever's left over in terms of disposable income gets spent on food then.
Yeah. Last week on World Hunger Day, we were in conversation with Dr. Busiso Moya, who is from the Union Against Hunger. One of the suggestions and recommendations that he had made was that perhaps maybe look at having the right to nutrition. And I thought that, considering that the Constitution already speaks about the right to access to sufficient food, that will also cover the nutrition part. But I found it interesting when looking at the Constitution that Section 27, subsection 1b, speaks about the right to access of sufficient food, but not necessarily nutrition, whereas when it comes to children, though, it says that with Section 28, subsection 1c, that every child has the right to basic nutrition. If we were to say, can we broaden that basic right can we open it up even to include adults as well? Would that have the ability to jolt lawmakers into action that says that it's not just about access to food, but it's access to nutritious food?
I think there are two points in relation to that. So the first is that the right to food, so what you mentioned as 27(1)(b), to sufficient food, what constitutes sufficient food, so the content of that right hasn't really been unpacked in law. And there are some civil society organizations that are led by, at the moment, by the Union Against Hunger, that are trying to see how we can push for that unpacking. So sufficient food probably is going to cover nutrition, but because there isn't really a test case, or there hasn't been an unpacking of what constitutes sufficient food, it would be worth in law to unpack that, and therefore ensure that the different elements of the right to food are addressed in policy and practice. The other distinction between the two rights, so the Section 27(1)(b) that speaks to adults more broadly, or to everyone actually, and 28 that speaks to children specifically. So as you mentioned, the rights of children to nutrition. So nutrition is specified there. But the difference between those two rights is also the rights for children are immediately realizable, which in law means that government can't provide an excuse of we don't have money to do this. Where for adults, so the section 27(1)(b) right is subject to what's called in law progressive realization. So if you read 27(1) or the clause just below, where it says right to sufficient food and water, it does say subject. So government needs to provide access over time and within its available resources. So there's quite a big difference for adults and for children. And that makes it even, and that's my final point, actually more shocking if you look at the stunting and the nutrition statistics for children, that despite that right being immediately realizable in the Constitution, we have such high level of stunting and malnutrition amongst children.
Yeah, and a final one, your recommendation, improved and more transparent data on food prices and monitoring of food affordability. Do you think that we should have like a committee that specifically deals with that?
I think that's a great suggestion, actually, because a lot of these things are quite haphazard. So there's a little bit of food price monitoring happening by NAMC, the National Agricultural Marketing Council, that sits under the Department of Agriculture. There's a little bit of food price monitoring happening by the Competition Commission. But I must admit, Aldrin, I sometimes feel like one PhD is not enough, because I don't understand that data a lot of the time. So it's not transparent, it's not comprehensive. So a committee to do that would be great, and doing it in a way that is really transparent and accessible, so that people can understand whether they are getting value for money and can understand who in the food system is losing and who's winning. Yep. Because a lot of this is also about power.
Definitely. Thank you so much for your time. Dr. Yvonne Erasmus is from the Socio-Economic Rights Institute.